And how does your perspective give meaning to people's distress experiences, such as hearing voices?
Well, a lot of the people that we see in services are, by definition, very distressed by their experiences. They seek help and are trying to make sense of why they've developed this particular mental health problem. So just let's carry on with the example of voices. It's rather interesting. So if I was seeing someone with voices, I'd be very interested in saying, well, what is your relationship with this voice? Now, voice hearing is not just a distressing experience, of course. It can be a distressing experience, not always. But nearly always, people who hear voices will personify the voice. They will assign it a name or an identity. And very often, very often in services, most people who hear voices will ascribe great power and authority to the voice, and will also ascribe it to a particular kind of motivation. Sometimes that is a malign motivation to do harm or otherwise to the individual. Sometimes it's of a benevolent intention. But the key thing, very often in distress with voice hearers, is, as it were, the power imbalance between you as a voice hearer and the identity and the purpose that you ascribe to the voice. And that alone is highly linked to the development of distress. So I should say that people often think, well, it's the frequency of the voices or how loud they are, and even what they say creates the distress. Well, it's research that we've done and others have done have shown that not to be so much the case. It's not the frequency of the voices or the audibility or even what they say sometimes. The important driver of distress is this power imbalance, the perception of the voice as omnipotent and powerful and omniscient, and the voice hearer as very subordinate and deserving of their subordinate position. So there's two aspects to that are important. One is, well, why is it that people have developed this subordinate relationship to a voice that perhaps they've had for many years where they didn't have that kind of relationship? This goes back to your question about meaning. Because this relationship with the voice is a social relationship. It's a relationship like any other, but it's a particular kind of relationship where someone feels under the power and authority of something very, very powerful and often malevolent. So the kind of things I would do with trying to make sense of someone's distress is, first of all, say, well, why is it that you believe this voice to be so powerful and you to feel so powerless? And to work with the individual beliefs that people have about the voices in particular, what makes them feel so strongly that the voice is so powerful. So the aim of therapy in that case is not to get rid of the voices, but is rather to try and help individuals to reduce this distress that's linked to them. One dimension of that is trying to work with the beliefs about the voices. There's another dimension, which is that the subordinate relationship people develop in this particular relationship between the voice hearer and the voice. Research that we've done has shown that this subordinate relationship is seen in other social relationships as well. So if someone is feeling lacking in confidence, sort of cowed and downtrodden by the voice, very often, if you ask them about other social relationships, you'll see the same thing being played out in those relationships as well. And this is very important because what we can try and helping to give meaning to this experience, the meaning that we give to them is to say, well, look, this is a relationship and you've developed a kind of, if you like, lack of confidence, lack of assertiveness perhaps in many social relationships, and this is affecting and making you quite distressed in this particular relationship with the voice. So the second therapeutic option there, and second way of trying to make sense of it, is to work with individuals' sense of subordination and sense of inferiority to other people. That goes back to our opening part of our conversation, where I was describing how individuals' developmental experiences can give individuals a sense of lack of confidence and of inferiority and loss of self-esteem. So I hope perhaps you can see the connection as to how that can influence the way in which people develop a sense of low self-esteem and inferiority in relation to this particular relationship. So we can draw upon those personal and social influences on someone's development in how that is brought to bear in relation to the relationship with a voice and in relationship to other people. And this provides, I hope, some meaning to that particular relationship and some interesting therapeutic options. Obviously, distress is manifested in different ways, and what also interests me is the way in which people can get distressed by the experience of receiving a label or receiving a diagnosis and its social consequences, and this interests me a great deal. So we've been doing a lot of work over the last few years on how people internalise what I guess you'd call stigma and its social consequences. Well, stigma, mental health problems are stigmatised in just about every society there. Mental health problems are constructed in slightly different ways, but there are very few societies and communities where mental health is not a stigmatised experience. And what we've been particularly interested in is how the experience of mental distress, and being a psychologist, I'm interested in what people believe about those experiences and how they appraise them, how that has consequences for the individual. So I've been particularly interested in depression in people who have a diagnosis of psychosis. As you know, depression and particularly suicidal thinking is actually very common in people with psychosis. Extraordinary high rate of suicidal thinking and suicide in psychosis, particularly in young people. Something like 10%. It's quite a problem, not terribly well understood. And we've been particularly interested in how people's reactions to an internalisation of stigma can lead them along that path. And as I say, as a psychologist, I'm particularly interested in what people believe about certain events and how they appraise them, as we say, and its consequences. So there are three appraisals, three beliefs that we believe are very important. They are loss, shame, and entrapment. So individuals can feel a sense of loss, that the experience of mental health problems has led them to lose their social position or their social role in society. And that may be an enforced loss of social role or something that the individual has engineered for themselves as a result of experiencing stigma. Shame is kind of self-explanatory. There's a kind of sense in which you can't hold your head up high amongst your peers, and look other people in the eye and feel confident and proud of what's happening to you, and that you've been people can learn to rise above it. But also entrapment is very important. People can feel entrapped in an illness and in experiences in relation to voices, as we were saying earlier, or some people can feel a sense of entrapment in a major mental illness like psychosis. For example, if people find themselves going back into hospital or being subject to the Mental Health Act perhaps more than they should do, this can convey and people internalise a sense of loss of control and being trapped by an illness. So these are the kinds of things, these appraisals of loss, shame and entrapment, which are very important in the development of depression, as we were discussing at the beginning. But these are key appraisals influencing, key appraisals of major mental illness, which are very strongly predictive of individuals developing depression and suicide as a result of psychosis. So you asked me about meaning, and the meaning that people ascribe to being having a label of mental illness and a diagnosis is very, very important. And it's very important in trying to help people to understand why they're reacting as they are, why they've become depressed or feeling that life has got no future for them. And so again, as a psychologist, I'd be trying to work with those particular appraisals or beliefs.